I've been involved in diabetes care in some way for about 25 years. Initially, it was part of my work where I was. I worked at a local rural hospital, and I was part of a team of providers where we provided support for people with T1D. I have been with Blue Circle since April of 2024. It is such a unique place to work, and we just offer something that you just can't find in traditional healthcare settings. What we do is an adjunct. It's a support to what a person's primary care physician or endocrinologist does. Maybe there's some additional education that the person needs that is not available, or some services like insurance navigation, or some connections to resources with case management, or diabetes-specific counseling, which is huge and really not very often found. I was really excited when the job opportunity opened up and was eager to join Blue Circle for lots and lots of reasons. But I think the most important reason was that it offered me the opportunity to work with people with type 1 diabetes in a unique way, a way that was much more holistic and effective. As an educator, I can talk to people about a variety of things. Very often I'll see a biggest need is sometimes just understanding more about T1D. Like, what is it? What is basal bolus insulin? How do I best dose for meals? How do I figure out my insulin correction factor? How much insulin do I need to bring my blood sugars down? How do I prevent hypoglycemia or treat hypoglycemia without having rebound highs? Kind of standard diabetes education questions that someone might just not know, not through any fault of their own. They just weren't given the opportunity to be taught that or to learn it. And I think once somebody has that understanding of how it all fits together, it changes everything. With T1D, everybody gets judged so much about their numbers. I think that's part of our job here, is to support people as people and to give them the tools so they can look at the results. When somebody has a breakthrough moment, when they learn something new, either a new skill, or they get a new tool, or they just get some basic education that they never had before, that helps them understand better how to work with T1D. And all of a sudden they get results. They no longer have lows, or they no longer spike big after a meal, or their A1C drops. It's really such a rewarding moment. It's joyful to me. It fills me up. It just fills my heart so much, because I know that I've been part of that person's journey, and that I've done some good work in the world. I've helped somebody else live a better life, and that's really important. It means a lot to me. My hope is that they walk away with a greater sense of confidence and the knowledge that they need to move forward and live long and healthy lives, to live more easily with T1D.